I'm happy to yield to Mr. Fortenberry.
Thank you so much, Madam Chair. First, let me note the importance of our effort today. Health and education and good opportunities are central to America's concern, and this bill is complex and multi-layered. It captures the best of our mutual considerations and highlights some of our deepest philosophical differences, as we've heard. But first, I wanted to thank Chairwoman DeLauro and Ranking Member Cole, frankly, from the bottom of my heart, for their support of ALS research and expanded access for innovative treatments. ALS is a degenerative disease for which there is no cure. It's sometimes known as Lou Gehrig's disease. Madam Chair, when I was about 8 years old, I read a book about the great Yankee first baseman, and it stayed with me. And then you fast forward decades later, and here we are, and this cruel disease has swept upon me and affected my own family. And we quickly learned about the profound trauma it has caused so many other Americans. I hope Ms. DeLauro doesn't mind me sharing this, but about a year ago, I talked to her on a personal basis about some of these sentiments. And we all know that sometimes Rosa can be intense, and she got in my face and said, "You better fight for this, Jeff." So I want to thank you, Rosa, for that encouragement. Perhaps we also should point out that this does solve a problem for patients who are not eligible for clinical trials. This is brand new. It's never been done before. We've come together to make progress, and I'm proud of that. And this didn't magically happen, though. It's been the course of a lot of work, over months and months of dialogue between us, including conversations with the National Institute of Health to develop a proper understanding as to how to proceed. And parallel to this effort, I want to point out to the committee is a new bill called Act for ALS, formerly known as Accelerating Access to Critical Therapies. Last week, Congressman Quigley, who is the lead sponsor of the measure, and I were on a Zoom call with several hundred people who suffer from ALS, their caregivers, their families. They powerfully pleaded with us for action and at the same time expressed profound gratitude that this committee and many members of Congress are starting to take new initiatives in this regard. Today, for example, Dutch Ruppersberger agreed to co-sponsor this bill. And other members in this room have already done so, including Mr. Cole, Mr. Calvert, Mr. Womack, and Dr. Harris. Again, I'm proud of the effort here. Support is also growing across the nation. Dr. Merritt Cudkowicz from Harvard Medical School wrote to me, he said, "I am fully supportive of a government approach to make this affordable for academic centers and for companies, and much more broadly available to patients with ALS who are not trial eligible." Dr. Richard Bedlack also wrote, and he said, he's with Duke's Health Department of Neurology, and he said this: "More than 90% of my patients were never able to find a clinical trial in which they could participate." We've got a lot to do, but I think there's good progress being made today. On another issue, Madam Chair, I would also like to thank the committee for adding language to support Medicaid data to help guide the states on what treatments and prevention really do work. Real-time knowledge can help us make better choices for our patients to improve health outcomes. And finally, I do want to make a point that is emerging in our healthcare world. Children born early or at risk of disability can present a jolting challenge for families and the medical community as to how to care and respond. I had requested language to help clarify the role of hospitals and providers to help these most vulnerable newborns. And I hope that we can find common ground in this area, that we can help doctors and nurses and support families who are looking for compassionate guidance to protect the dignity of those small lives. That, Madam Chair, thank you. I yield back.
Before I call on the next speaker, I just want to make a few comments because I'm sure we don't have a great audience out here throughout the country listening to the members debate and discuss the friendship between Democrat and Republican, the commitment on the part of Democrats and Republicans. But as I heard you speak, it made me realize again how much passion there is on behalf of all of us, Democrat, Republican. We're not here just to pass bills by rote, whether some of the passion comes from personal experience or a neighbor who shares a personal experience. There are really such great members in this room, and I do hope that there's an audience out there understanding not only how important the work is, but how important these members are. They're not just eloquent because they want to give a great speech. It's because you feel it in your heart. So I just can't help but comment, and I thank you. Miss Lee.